for joining us month after month as we conduct these monthly programs that are intended to educate the family. And I want you to know that we are currently streaming live on YouTube. So if persons are not able to join via the Zoom platform, they are able to watch on YouTube. And you can use the link CSS North 83, that is CSS North 83, and they'll be able to access our video footage joining on YouTube, and they'll also be able to watch as we that are conduct on the program. Right. So without further ado, we are going to get straight into our discussion. And as indicated, this evening, we are discussing the role of the Public Health Authority in promoting health and disease prevention in Jamaica. Now, over the past couple of months, we know that we have had an outbreak of dengue. And we have also seen for the past couple of years the outbreak of COVID-19, and we have seen all the various variants, etc. We know also from time to time that we have other diseases and viruses that outbreak in society. And we know too that sometimes these can be prevented if there are certain health protocols that are followed or certain best practices that are maintained by citizens. And so we want to delve a little bit into what the Public Health Authority, what the NSWMA, what they do, and what their role is in helping to safeguard Jamaicans against any form of outbreak of disease or any other health implications that may be posed. So ladies, I'm just going to afford you an opportunity to, first of all, tell us a little bit about your organization and what you do. And I'm going to start with you, Dr. Prosper-Chen. So you can feel free to unmute your mic. Go ahead, tell us a little about yourself and about the public health authorities.
Good afternoon, everyone. My name is Francia Prosper-Chen. I am the Medical Officer of Health, responsible for the parish of St. Catherine. I am the lead officer in the Public Health Department, and that covers a number of programs and facilities. We have 27 health centers and 2 hospitals. We are responsible for the maternal and child health programs, which include the antenatal program, the postnatal, family planning, immunization, control of diarrheal diseases. We also have our curative program, where if you're ill or you have chronic illnesses, you can come in to see the doctor. We have a community mental health program, the child and adolescent mental health program, the oral health program, the STI, HIV, TB program. It also falls under our domain. We have a very large environmental health program, and that covers all areas of environmental health, from vector management, occupational health and safety, institutional health, food safety, veterinary public health. So we are also responsible for the large and small poultry and other food operations in the parish. We are the lead agency in the parish for disease outbreaks and for health disaster management in St. Catherine. We have a responsibility for surveillance, not just for infectious diseases, but also for chronic diseases. Our portfolio is wide. We also have public health responsibilities in the hospitals. We do routine inspections of the schools, of the infirmaries, the nursing homes, and even private and government factories and business places. We manage a lot of the programs that come down from the ministry, and you would know of the Know Your Numbers campaign. You are aware also of our public-private partnerships. for chronic illnesses and for HIV. We have the chronic care model project that's going on now also. So our scope is wide. Immunization is probably one of our, should I say, a sacred program for us. It's extremely important for us, and we have had significant success with that program, and we call it our flagship. And we are quite proud of it. Jamaica has done very well. We have won international awards because of our immunization program. I think that's where I leave it. There's a lot more that I could tell you.
Wow, thank you so much, Dr. Prosper-Chen. I know that already I've started to get some education because I believe that when we think of the Public Health Authority in Jamaica, we tend to limit them to the work of the public health inspectors. You know, I believe that that's what most Jamaicans do. So just from your introduction just now, I am realizing that there are so many different facets of public health that you touch and you tap into and that you have responsibility for. And so thank you so very much for that, because I'm pretty sure that some persons on our platform were not aware of that. So thank you so much, Dr. Prosper-Chen. Now, Ms. Reid, it's over to you. You can go ahead and tell us about yourself and about the National Solid Waste Management Authority. Ms. Reid, you're still muted. You're still muted.
Okay, I'm sorry.
All right.
Good evening, everyone. Okay, my name is Rachael Reid. I'm the Customer Relations Officer for the MPM Waste Management Region. Now, I've been with the authority, the NSWMA, for 13 years. I was at the NSWMA, and in 2001, I was transferred to the region, MPM region, which is responsible for garbage collection in Kingston and St. Andrews, St. Catherine, and St. Thomas. But let's start with the NSWMA. Now, the National Solid Waste Management Authority, they are the regulators for the waste industry in Jamaica. So what does that mean? It means that we are responsible for safeguarding public health as it relates to the proper management of solid waste, garbage in Jamaica that is generated by residents. Now, the authority has 4 regions that is directly responsible for the collection, transportation, and disposal of solid waste in an environmentally safe manner. Now, these 4 regions have day-to-day responsibility to collect garbage. We sweep the streets. We also have our public education department, as well as we train community members and other persons as wardens to help us to safeguard public health and the environment in Jamaica, right? Now, directly for public health is to ensure that garbage is removed from the environment as quickly as possible and disposed in the proper way. Now, in order to help us to do that, we also educate residents on proper solid waste management practices. Now, they are the generators of the waste in Jamaica, and it is a known fact that sometimes persons believe that their responsibility ends when they're finished and they put the garbage outside, right? But we all have a responsibility for the waste that we generate. Residents have a responsibility, and us at the National Solid Waste through our regional offices have a responsibility also, right, to ensure that garbage is managed safely. Now, it is true that in terms of public health, right, it cannot be emphasized enough that the NSWMA and its regional bodies cannot do it ourselves, right? And it is of known fact that we really need the help of Jamaicans in order to manage waste, because I don't believe, and it is true, I can speak for the authority, that collection is the issue in Jamaica with garbage, improper garbage disposal, because you have several communities. I personally know communities in Jamaica that has garbage collection 3 times, and per week. And when I asked residents, why do you dispose of the garbage improperly at dump sites? A gentleman told me from a particular area that, you know, we don't have enough, we don't have, the container is not big enough to hold the garbage. And sometimes people don't want to keep the garbage in their yard, so they just carry it out the road and throw it out. Maybe you should collect the garbage every day. Give us collection every day, right? So it's an uphill battle that we face at the NSWMA, right? And we are now asking residents to just assist us, help us to keep the environment clean. We also ensure that we let residents know, you know, how harmful improper disposal of garbage can be to you and other persons in and around you. Because not because it's not in your general, your immediate space, doesn't mean that it is not affecting you directly. There are other ways that it can affect you, like blocking drains and gullies. In the event of a hurricane or flooding, persons can be flooded out, vector disease, and I can go on and on, right? So, you know, our job at NSWMA is just to ensure that persons understand how to manage the waste so that it doesn't become harmful to them and the environment.
All right. Thank you so very much, Ms. Reid, for that. And again, another education session because, you know, many Jamaicans, once again, limit the work of the NSWMA to garbage collection.
Garbage.
You understand? And so I believe that it's important for us to understand that this is not all they are about. This is not all that they do. You know, there is much more that exists within the organization, and they have much more responsibilities than just going from community to community and collecting the garbage, you know. And so thank you very much for sharing that information with us. Now, ladies and gentlemen, I want you to understand that you are able to ask questions on this platform. If you would like to ask a question, make a comment, you can use the raise hand feature and you will be acknowledged and you can do so. Or you can type your question in the chat, and as soon as we are able to, we will ask your question so that you can get your answers. We want you to participate in our discussion. So it's not just myself, Dr. Prosper-Chen, and Ms. Reid that's going to be talking. We want you, our citizens, to engage with us as well and participate as much as you can. So now, ladies, I just want to ask a question because just by your introductions, I'm realizing that there is probably a whole lot that most Jamaicans don't know about your respective organizations. So my question is there any education campaign that you have going on that is intended to educate our citizens on what the Public Health Authority and what the NSWMA does or is doing within our communities? So I don't know which one of you want to start. Ms. Reid, you go ahead.
Okay, so our public education is ongoing, right? Through our community relations department, which is at the NSWMA, and our customer relations departments at the regional offices, we educate persons on proper solid waste management practices through community meetings, forums, such as this one. And also, we presently have a campaign now going on in schools. We're going out in schools and we are educating students on proper solid waste management practices, particularly at the primary level. Because what we realize is that in order to effect behavior change for the future, right, we need to reach the younger generation, right? And through our interactions with schools, we realized that there was a great need to educate children and administrators on the proper management of garbage at the schools. Right now, children just, you know, litter, wanton litter garbage all over the school, you know, even though the garbage is packaged at the school for collection when we go to collect it through our commercial departments, right? We have our inspectors, you know, complaining that it is not properly bagged and, you know, before it is put in the bin, right? So we use these forums to go around all over Jamaica through our respective regions to educate persons. We also put on forums ourselves, and we encourage residents through their community forums to invite us to meetings. So as many meetings that we can go to, as many opportunity as we get, we go out and educate persons on proper solid waste management practices. We also do that daily through our social media sites, NSWMA and the regional bodies. We put out on a daily basis information on how people can properly manage waste. We also let persons know how it will affect you in case in the event that you don't manage the waste properly, right? So it's our daily activity for us in terms of public education, right? And we are always coming up with new ways to go out and educate the public on proper solid waste management practices.
All right, thank you so much, Ms. Reid. And I'm happy to know that you're going into the schools with this campaign, because it's important for our children to know how it is that they are to dispose of their waste properly. And it's important for them to learn at an early age so that we can begin to break the cycle of pollution. When children learn these things, then they take it with them into adulthood, and they'll be able to teach their own children. And that is how we can see our society moving from just, tossing things through car windows to properly placing things in bins as they ought to be. So thank you so very much for that, Ms. Reid. So Dr. Prosper-Chen, go ahead and tell us what kind of education campaign the Public Health Authority has going.
Our education and our campaigns are also ongoing, as Ms. Reid spoke to. You can well imagine when it comes to health and the environment, then we are always out there trying to encourage communities and the persons to take care of their health. We have information and campaigns on social media, broadcast media. We also do a lot of print, brochures, posters, and particularly we celebrate commemorative days. So World No Tobacco Day, we celebrate World Physical Activity Day. All of the commemorative days, we try as much as possible to have some sort of forum for persons to know exactly what it means for them and for their health, for their families, and how they can participate or help to make communities and people safer. We are quite involved in schools. Presently, we are responsible for the Jamaica Moves in School program, for our school health program, ensuring that the children in the basic schools are fully immunized, and that is for protection for the whole population. We are well aware that with the COVID-19 pandemic, the world fell off in having children properly vaccinated to prevent diseases. And we are seeing across the globe outbreaks of measles in many countries. And measles is particularly detrimental or harmful for children under 5 years of age. So our programs are ongoing. We promote a lot of interventions. We do food demonstrations, our nutritionists, to teach people how to prepare meals that are nutritious or that are better for them, bearing in mind their state of health. So we are also always doing health education.
All right. Thank you so much, Dr. Prosper-Chen. And, once again, the children being involved in this is absolutely important, because, it's never too early to start teaching our children certain things and for them to learn to have an appreciation for it, because it makes things better for us as a society, especially going forward. But you made mention of something just now that I found rather interesting in regards to the outbreak of measles in some places in the world. Now, have we been seeing an upsurge in cases of measles in Jamaica? And if not, what would you say makes the difference here for us versus in other countries?
No, we certainly we have not seen measles in this country that's locally transmitted since 1992. we saw our last case. And that is why it is so important that we continue to immunize our children against measles. We did fall off, but we're just coming out of a mop-up campaign where we were actually looking for all of those children who may have missed their doses during the COVID-19 pandemic. And that campaign was relatively successful. And as usual, we continue to send out our community health aides to find those children who did not come in. And of course, all of our health centers offer vaccination except for the dental clinic in Bridgeport. And so we have to be very vigilant and ensure that we do everything possible to ensure the children are vaccinated.
Okay.
And that is one of our flagship programs. We spend a lot of time ensuring that.
All right. And I'm happy to know that we have not been seeing any locally transmitted cases. But does that mean we have seen persons come from outside who have been diagnosed with it?
Every now and again, we might see one case, but we have the systems in place to ensure that does not, that there is no spread. So that calls for an outbreak response, and all the resources go into isolating and ensuring that we do not have any local transmission of measles. And we have been very successful there.
Wonderful. And I think the fact that we have not had any locally transmitted case since 1992 speaks volume. That is well over 30 years, 3 decades of no case of measles in Jamaica. And that is wonderful for us because, as you said, it is very harmful to children under the age of 5. And I mean, we wouldn't want to see our Jamaican children dying for any reason, let alone for something that is preventable. And so we're happy for that. And I want to encourage parents on this platform, if you know that throughout that COVID period, your child had missed any vaccination that they should have received, or if you know of a family member or a friend whose child may not have been vaccinated as they should have, I'm encouraging you to tell them to take their child to the clinic with their vaccination card so that they can get the requisite vaccination. It is very important for the protection of our children and for us as a society. So just a little bit of encouragement for our parents on this platform. Now,
If I may,
go ahead,
Mr. Fennel. I'm just correcting, it's 1991.
Oh.
The last case of measles. Our last case of polio was 1982. The last case of diphtheria was 1995, sorry. Rubella was in 2000, and neonatal tetanus 2001. So we have done very well.
So in other words, what I'm hearing now, Dr. Prosper-Chen, is that whilst for us as Jamaicans, we have been beating our public health systems, really and truly we have a reason to applaud them. That is what I'm hearing from these statistics that you are providing and this information that you're providing. Oh. So for me, it provides a different level of appreciation for what our public health authorities and what the health system is doing here in Jamaica. So, just like anything else, there will be hiccups, there will be shortcomings, there will be imperfections, but really and truly, I believe that we have a lot to be grateful and thankful for to our health system and our public health authority in keeping our children safe. So thank you very much for that information. I do want to go to a question in the chat that is coming from Marcia, and this one goes to you, Ms. Reid. And the question is, when will we be addressing the issue of garbage separation so that our plastics can be recycled?
Okay. So it's a known fact that the NSWMA and its regional bodies, we don't have enough trucks to collect garbage separately, right? But that doesn't mean that we're sitting on our hands and saying we don't have the resources to do it. So what we do is that presently we do have a plastic separation initiative in the Northern Belt, right? With a number of communities in Kingston, where we at the NSWMA, we collect plastics weekly in some communities. And now the collection depends on the generation we recycling partners to assist us with the collection, right? So through our community meetings, we separate plastics from the regular waste, and we partner them with recycling partners, their mesh bin in the communities, and to facilitate the separation. They will collect, as well as we will assist to collect the plastics from the waste stream. The participant asked is a very important one, because at the NSW, we are passionate about getting plastics out of the waste streams. We don't want it on the disposal sites. Harmful it is, and when we have a fire on the site, spontaneous or otherwise, right, we don't want these plastics on it to burn. If you go on our disposal sites, you'll see a section on the site that is designated for the separation of plastics from the regular waste, right? So we have not nationally, we have not gone out nationally and say, okay, we are separating, but we are encouraging separation of plastics. On the 18th of this month, it will be Global Recycling Day, right? And on that day also, we will be educating the Jamaican population on how and encouraging them also to separate the plastics from the regular waste, right? We encourage persons at home. So if your community is not doing it and you want to do it, we encourage you to do it, right? And we also partner with recycling partners where you can take your plastics and they will pay you, right, for the plastics that you take to them. They pay by I think it's per pound. It has been, the cost has been in that many persons are using that opportunity to separate communities. So if the person asks the question, your community, and you're interested in your community starting your own plastic separation, we will encourage you to do so. And we will also assist you with the collection, whether it be through our office or to partner with recycling partners to do so.
All right. Thank you so very much for that response. And with that, you indicated that it is not yet a national effort, correct?
Right, not yet. But you would have heard in the news that government is setting up a recycling center, right? That's not ready as yet. But so there are things in the background that is being done to facilitate this, right? And I'm sure sooner than later, it will be on stream nationally. And we can say to Jamaicans, start separating your plastics. We will be collecting it separately. As a matter of fact, I also know that my executive director, with the new trucks that we should be getting in short order, I know that he is looking into designating a few of those trucks just for plastic separation, right? So I know that it is something that is actively being discussed. It's actively being pursued, right? And we are eager, as residents are, to start getting plastics out of the waste stream.
All right. And I want to say too that, you know, if we are realistic about what we're doing or what we're seeing, one of the things that you hardly ever see, if any at all, is one of those D&G bottles in the garbage. And the reason for that is because people understand that they can get paid for them. So persons will walk around and they will collect those bottles and they will put them in crates, in bags, whatever, and they will take them to the various locations where they can be paid for them. And you are now letting us know that if persons were to recycle their plastic bottles, they can also be paid for it. Maybe not the
Yes,
same amount, but they can also be paid for their waste.
yes, they can be paid for their waste. And just as persons are collecting glass bottles to take back for return of money, persons are also actively storing plastic bottles, right, to take in for money. You might be driving through some communities, excuse me, and you will see a number of plastics, maybe in the big bags piled up in communities. Those are the plastics that are being collected and taken to recycling partners, and they are paid money back for those bottles. I should also add that recycling partners, it's a partnership between government and private sector. So those companies that like Wisinco and all those other companies that produce products in plastic bottles, they are partners they are the partners in recycling partners as well as government, right? So it's a private and government partnership with recycling partners of Jamaica.
All right, thank you. And you guys have a very catchy jingle that I've been hearing on the radio repeatedly with Assassin, our agent Sasko, as he goes
Assassin,
by
yes.
now. Right.
It's
It's a
in
very
Saxco
catchy
now,
jingle. So
right, right.
I'm sure that person's must
Very
have heard it
catchy.
at some point.
Mm.
Right. So encouraging us here to rather than disposing of our plastic bottles incorrectly, let us properly store them so that we can be paid for them. So when you use your money and you purchase
Yes.
your juices, etc., rather than just throwing them out on the street, let us store them so that we can get paid for them. So that's the word to you, ladies and gentlemen.
I want to also leave a word with ladies and gentlemen. We can even go a step further. Instead of we can eliminate some of those plastic bottles. So say for instance, persons on the platform, you drink bottled water. Instead of I'm in the supermarket and I see persons buying 2-3 cases of water and taking home. I'm going to encourage those persons on the platform, stop buying the cases of water, get 5-gallon water bottles, get reusable water bottles. That way you generate no waste at all. It is also much more economical to do because a case of water can cost you anywhere from $800 to over $1,000. With the 5-gallon, you can pay as low as $300 to refill, right? So it is not only environmentally friendly to practice proper solid waste management, it is also economical to practice proper solid waste management.
Okay, that is wonderful. Thank you so very much for that. And, a good word of encouragement there because I understand the benefit of that practice because I have a couple of those 5-gallon bottles myself that I refill from time to time. And it is very cost effective to do so, believe me. Because, as you indicate, a case of water runs you anywhere from $800 to $1,000. And how long does one bottle of that water last you? So thank you so very much for that. I want to ask this question though. We're talking about the education campaigns and we're talking about all the things that the NSWMA and the public health authorities are doing for us here in Jamaica. But what are some of the challenges that these organizations face in going about their day-to-day activities, in being able to deliver the service that you do to us here in Jamaica? Tell us some of the challenges that you face and maybe how we as citizens can assist in alleviating some of those challenges. And we can start with you, Dr. Prosper-Chen.
Yes, there are many challenges, as you can imagine. We're dealing with people, and there will be resistance in some cases. But I think probably what we battle most with is change in behavior. A lot of what we have to do in public health relates to changing a behavior in order to change a particular practice. And changing behavior is not easy. Persons have to be willing to change. And a lot of the behaviors are cultural, traditional. You know, persons are used to doing certain things, and it cuts right across everything. If we start from the baby, we know that breastfeeding is the best way to feed your baby. And yet we have a lot of grandmothers and aunties and great-grandmothers that are telling our young mothers, yes, you must give the baby some mint tea or bush tea or something. And that is not breastfeeding. It's not exclusive breastfeeding. When we speak about breastfeeding, we mean nothing other than breast milk. And our message is nothing other than breast milk from 0, baby born, to 6 months. Baby is now 6 months old. So that is a challenge. And then we have the other challenges related to how we feed children or young children, where we think that if the child is chubby, that's a healthy child. And all of this is related to how we grow up. And then we can go to the infectious diseases, even something like HIV, and the whole battle with using a condom. So behavior change is our biggest challenge, really. And I'll leave it at that. We have a lot of others, but we have strategies to try to deal with it. But our biggest challenge is behavior change. How do we get persons to do things differently and to sustain that behavior? I applaud NSWMA when they speak to plastics, because we know, I'm sure Ms. Reid knows, that one of the hardest things that we have to do is to get people just to separate it. And that's probably going to take years of education before we finally get it. And so maybe 5 years down the road is when Ms. Reid can says, yes, we are ready to start separation. So I think change in behavior is probably the biggest challenge for her and for us in public health. And she is public health too.
All right. Thank you so much for that, Dr. Prosper-Chen. And I totally agree with you, because even for us here in law enforcement, where certain things are concerned, as it is cultural or it is societal, meaning that it is synonymous to a particular community, or it is something that is practiced within certain communities. And you ask yourself the question, how can you get people to change and to see things from a different perspective? But if we really look at it, when a society has been indoctrinated a particular way over decades, it will in fact take time for that change to occur. And that is why I fully support the idea of starting to teach our children from an early age so that we can start to break that cycle. I completely agree with that stance and with that method. And so, change in people is one of the hardest things to get, because you and I, as much as we wish we could, we can't change anybody. People must be willing to change themselves. Yeah, so thank you for that, Dr. Prosper-Chen. Ms. Reid, I know that she speaks for all of us when she spoke about, the change being one of the biggest issues, but what else is there for the NSWMA as a challenge?
Okay, for the NSWMA and its regional bodies, right? Dr. Chen was perfectly right? It takes consistent and sustained public education, as well as at the family, the local level, from the household, to change behavior. And you are perfectly right. It starts from a young age, because let me just use this opportunity to say, when I was a child growing up, right, my mother, we used to say she's a clean freak. We as children, we used to say that, right? But she used to tell us not to litter the streets, right? If you have, she said, when you're coming home, you're eating snacks, put the garbage in your bag. So on a Saturday morning, you'd see us, she had 9 of us. So those of us who were going to school, we would, on a Saturday morning, you'd see us shaking out our bags over the garbage bin because we had sharpener, dust, paper, everything inside there. So, you know, she encouraged us at an early age not to litter the street. And believe it or not, I took that with me through to now. And I keep telling persons, it's no surprise I'm in this position, right? I don't think it's a surprise, right? Because of how I grew up. Now, the biggest challenge we have at the NSWMA and its regional bodies, right, is illegal dumping of garbage, right? Persons don't want the garbage in their space. As soon as they generate it, they want it to be removed, right? And it is the fact that Jamaicans don't think that they have a responsibility at all for the waste that they generate, right? And so getting Jamaicans to see it otherwise and to help us. So when we cry for help, right, persons are not empathetic or sympathetic with us because they're saying, oh, it's your job to remove the garbage. We don't have anything to do with it and so on. But look at it. The garbage truck doesn't come for a week, maybe 2, right? Maybe 3. What does some of us do? For me, I continue to containerize, or I'll call to find out when the garbage truck is coming, right? For other persons, they'll take the garbage, they'll put it in their vehicle, and when they're driving, the nearest dump site on the main road or a little place where they sell little garbage, they'll take the bag out and put it there. Or if they're driving over a gully, they toss the bag over a gully or something. And this is not a practice for any particular class of or otherwise in society. Everybody does it, right? Everyone does it, right? So if it's not a blame game who does it or who, persons who you think should know better, they're the persons who are doing it, right? So improper disposal of garbage is a major challenge for us. Okay, so you know one of the major reasons why we sometimes delay in collecting communities? Because when we go into a particular community and expect to spend an hour or so going through and collecting, we spend 5 hours, 4 hours. Why? Because we have to be stopping at several disposal sites to be scraping up, sweeping up, and cleaning up garbage, and that takes a lot of time, right? So the truck will go out to go to 2, 3 communities for that day, right? And they end up only cleaning half of one community, right? Because of the improper disposal of garbage. So that's a major challenge for us, right? And it's not only at the household level, it's also at the commercial level, because you have a lot of businesses that are disposing of garbage improperly, right? You have a lot of persons who are social constructions, right? Even the persons who they hire to do registered waste haulers who are hired to dispose of the waste in an environment, they take the garbage from these locations and they find the nearest open lot or night, and they go there and they dump it off and they dispose of it and they leave because nobody at that time and nobody's seeing, right? So it's an uphill battle. It's like we're climbing, we have nothing to hold on. We're going up. You know, we can't find the solution to having people stop this practice, right? And persons need to understand that when you do this, you are only harming yourself. You're harming yourself, because when you take your garbage from your home, put it on the roadside. Say, for instance, there's a heavy rain, that garbage washes down into the streams and the gully. It gets out into the sea. It will even go into communities and block drains and cause problems, you know? So it's a major problem. You know, one of the things with Jamaicans, and I say this sometimes, that Jamaicans, we are the proudest persons you come across. But when it comes on to pride in our country, pride in our spaces, we don't have it. We'll go overseas and we will practice what NSWMA has been telling us for years. But when we get back here, we go back to our bad attitudes. And then some of us even have the nerve to say, oh, in the States, you know that this and you know that we do this, I know that they do that. Yes, we do that here too. But in the States, they have persons who actually comply and assist government in keeping the environment clean, right? It's an uphill battle for the NSWMA's regional bodies, but we continue to fight and we continue to push until we get there.
All right. Thank you so much for that, Miss Reed. And, indeed, compliance is important. And one of the things that I just want to advise persons too is that it's a challenge for the NSWMA with the illegal dumping, but it's also an offense for which persons can be prosecuted. And, I want to encourage persons that don't throw your garbage, don't pollute our society. And if you are caught doing it by the police, you can be arrested and charged for it. And you will find yourself in court paying a fine when you could have simply just disposed of it in the garbage bin as is required of you. So take and accept for the health hazard that it poses, it also poses a risk for you in getting yourself in trouble with the law. All right, I want to take the opportunity just to pause quickly to welcome our commanding officer for the St. Catherine North Division, Senior Superintendent Howard Chambers, who has now joined our discussion here. Senior Superintendent Chambers, just going to go ahead and say good evening to the platform. All right, I am not hearing Senior Superintendent Chambers, but he's here with us, ladies and gentlemen, the commanding officer for the St. Catherine North Division. All right, moving on with our discussion. In the chat, I'm observing some comments and some questions, and I do also recognize that there's a hand raised, Mr. Michael Brown, and there's another one as well. So that's Kerry Ann Roach and Michael Brown. So I'm just going to ask the question in the chat, and then I'll be with you, Mr. Brown, followed by Miss Roach. All right, so in the chat, I am observing Latoya Williams, who indicated about a policy. They said there needs to be a glass policy for distributors of products in glass outside of D&G. Says that this doesn't happen, meaning that outside of D&G bottles, other bottles are not recycled. Other glass bottles, rather, are not recycled. Do we know why that is, Ms. Reid?
Glass bottles are not recycled.
Right. Outside of D&G, where persons can collect and get paid for them. Why is it that it isn't done for other glass bottles?
We don't have the facility, not that I know of, here in Jamaica to recycle, right? Even our plastic bottles. Presently, we don't recycle plastics here. Ship them overseas for recycling. In some cases, persons will shred them, bale them. It depends on the packaging preference, and ship them overseas for recycling, right? But I hope we'll get there one day. You know, it is true that in Jamaica, we are way behind in terms of solid waste management, because in countries like Japan, where I have had the opportunity to study sustainable solid waste management in CARICOM member states, you know, when you go there and you see the magnitude, we have a saying, the Caribbean students that are saying that Japanese don't waste nothing, not even time, right? And it is true, because if they tell you that 7 o'clock you're leaving to go, don't reach 7, the bus will be driving out at 7, right? So they don't waste anything. They recycle and reuse every single thing that household generates. And when I say every single thing, I mean every single thing is either reused or recycled, right? We are going to get there. The government is actively in the process of getting there. But
okay, so a lesson there that we can take from the Japanese is finding a way to reuse our waste products as best as possible. All right, thank you, Ms. Reid. Now, I want to go to Michael Brown. You can unmute your microphone and go ahead with your question.
A very pleasant evening to you all.
Good evening to you, sir.
And I unfortunately joined the meeting late, so I do not know all the things that have been discussed. But listening to you now about the garbage situation, You know, it is a matter whereby the people have to be educated because there's always going to be a level of ignorance in terms of dumping garbage in gullies. There's always going to be that level of ignorance. I remember, are you hearing me?
Yes, we are hearing you, Mr. Brown.
Okay. I remember when Mr. Errol Green was at the KSAC one morning, I was heading to Kingston and I observed a car dumping garbage. This was near the Portmore toll. And I called him and he was able to inform me days later that the man got a ticket sent to his house. So, but you see, I don't know how consistent that method is. I really don't know because there's this culture of being an informer. So other people might say something like that and not pay it in mind, but they don't seem to understand the damage that it does to the environment, especially
That
when
is right.
plastic is involved. Especially when plastic is involved. On another matter, you mentioned about health. Health is more than one aspect because how I view it now in my community here in Spanish Town, some surveyors came one morning to survey where my road met another road. Well, it was the same road to be honest with you, because North Avenue, and there's a trench that is supposed to drain water. I'm sorry I can't show you a picture of the end result of that survey, whereby it has formed a pond. And I've written to the parish council and I copied the health authorities because guess what? This is going to breed mosquitoes. The water turns green, and you know, I, I was hoping that they would have responded to try and clear this up because one part of the trough, I have to call it a trough, is lower than the other. The water always gathers. Now,
Uh,
that is
Miss,
an
Mr.
aspect
Brown?
that's an aspect, especially when you speak about mosquito control and mosquitoes breeding. That's an aspect that should be corrected as quickly as possible. You were saying something?
Right. I was asking, what community did you say this was?
This is North Avenue, Hampton Green, Spanish
Oh,
Town,
okay.
and
So,
my
uh,
road intersects St. John's Avenue.
so are you identifying a mosquito breeding site there?
Yes, because a big pool. When I say a pool.
Okay. And that
What
is
it is,
that's
is
on
the
the
old
road
Spanish
itself?
Town situation where the water drains from houses. The water drains from houses, but this trough should have been a runoff. Instead of that, it is a collector.
Okay. All right. So, Madam Prosper-Chen, I don't know if this is something that would could be looked at from the vector control perspective.
Well, we will take a look at it.
All right. So thank you
Yes.
so very much for that, Mr. Brown. And Dr.
Okay.
Yeah,
Prosper,
man.
our
My
team
phone
looking
number,
at
if you need it, is 381
could you
2707.
could you type it in the chat, Mr. Brown? Could you please type it
Come
in the
again?
you can send it directly to us on the chat.
I can hardly hear you guys, I don't know. The volume is very low.
All right. Go ahead, repeat the number.
381 2707.
All right. Thank you so very much, Mr. Brown, for your contribution and
If I
for the
may,
information that you provided. Ms. Reid, go ahead.
if I may, yes, I want to provide Mr. Brown with some information. Okay, and everyone on the platform. Now, if you are a witness to illegal dumping in any way, shape, or form, the NSWMA has an NSWMA and you download the app and keep it on your phone. And take a photograph and send it through that app, or you can type a complaint, whether it be license plate number or otherwise, and send it through the app. The very good thing about this app is that it does not store information. It doesn't store telephone numbers or anything. So it's totally anonymous. No one, we at the NSWMA, we don't know where the complaint is coming from unless the person puts their contact information in the complaint. All right, so let me repeat again.
Well, I have no fear where that is concerned, because illegal activities,
Right.
I won't talk, I'll blow a bugle.
Right, but for other persons who might be afraid or hesitant, we encourage you, download the NSWMA app and go to the app, the Google Play Store, Apple Play Store, type in NSWMA and it's there.
All right. Thank you so very much for that information, because honestly, I didn't know that there was an app for the NSWMA. So that is
You
also
can
good
also report,
information for us here.
right. You can also report non-collection of garbage. So if your garbage is not collected within a week, which ideally you should get once per week collection, don't wait until 2 or 3 weeks. Call us, or send us a message on the app to report non-collection. I'm also going to drop my number in the chat where you can communicate with our customer relations department, right? And lodge complaints of non-collection or otherwise, as it relates to NSW.
Wonderful. Thank you so very much for that information, Miss Reid. And I'm pretty sure that many persons are going to jump on this app, because there are many times people want to make a complaint, especially about non-collection of their garbage, and they really don't know who to call or where to turn to. So thank you so very much for that bit of information. Miss Roach, Miss Kerry-Ann Roach, you can unmute your mic and go ahead.
Thank you very much, sir. Good evening, Sir
Good evening
Chair.
to you.
Good evening, Dr. Chen and Miss Reid. A very informative session. I want to tell you thanks. I really appreciate it. This is a simple question for Miss Reid, though. Even though you spoke about it, I'm very happy that you mentioned it, Sir Fennel. Since up until recent years, I've noticed you see signs about that you can be charged if it is that you dispose of your garbage improperly. I wanted to ask, real simple, do you find that this has been effective? Ms. Reid, have you seen any changes over the years? Have you seen a decline in these incidents since there is now a fine and you can be prosecuted in these cases?
Okay, so since the inception of the NSW, urinate, right? There has been many fines, many port presently through our enforcement department at the NSW, that we have increased drastically the number of enforcement officers that we had before, because of this problem of the rampant illegal dumping, right? We have also equipped them with bikes, right, so that they're able to do more patrols. We have also been doing more night stakeouts and investigations and so on. So yes, we have been prosecuting persons. Yes, on a daily basis, hundreds of tickets are written for illegal dumping of garbage. Also, the dumping of derelict vehicles along roadsides and so on, right? The question as to whether we have seen a decrease in persons' actions, sadly, I would have to say no, right? As a matter of fact, it has gotten even worse, and that is why at the NSWMA, we are putting in measures in place to tackle this through our enforcement department. We are equipping our enforcement department with personnel and the necessary tools that they need to go out and prosecute persons for improper disposal of garbage.
Right. Thank you so much, Ms. Reid. I
Thank
hope that
you.
answers your question, Ms. Roach.
Very clearly. Thank you so much.
Wonderful. Ms. Reid, there's a question in the chat that I find very interesting because from time to time we're traveling on the road and we will observe that an animal has been hit down by a vehicle or what we call roadkill. And you will pass that animal on the road for days until, you know, or other vehicles drive and all the insides and body parts are spread out all over the street, or you recognize that it starts to rot on the road. What is in place? What's the policy in place for dealing with road kills?
Okay, so I don't know of a policy in place to deal with roadkill as it relates to animals. Now, persons are responsible for their pets, for their animals, right? And so if these animals die, right, you are responsible to ensure that these animals are treated with in an environmentally safe manner, right? The carcass is treated with, meaning to bury. The proper thing is to bury. Some persons burn. We don't encourage burning in any way, shape, or form because that's not environmentally friendly, right? So some persons will bury it, and we're okay with that. Also, too, we have a number of calls coming in through our customers service department reporting these animals on the road, especially if they're on main roads, right? Now, once there's a truck in the area, we will remove in that area, we ask the animal. If they're in a community, right, and they're collecting, they will also remove. Persons can call us and report the dead animal, and we will remove them. Same day, because if we don't have a truck in the area, it won't be removed same day or same time, but it will definitely be removed at the earliest possible time.
Okay, thank you so very much, Ms. Reid, because you know that has always been a concern, and I'm happy to know now that we are able to call in whenever we see these animals on the road so that the carcasses can be properly disposed of. Sergeant Cecil White, who is the commanding officer for the Riversdale Police Station, has a question. Go ahead, Sir White.
Good evening, Mr. Fennel.
Good evening,
Good
sir.
evening, your panelists also, others on the platform. My concern really, and it's really a query, in terms of what I'm seeing really as it relates to the mentally challenged persons. Oftentimes, we get calls at the station from family members, people who are concerned about these persons, they appear to be getting no assistance. They don't know where to seek this assistance. And, and other time they just leave them and they're just out there on the streets. And, when things reach the level now, the police is called. So I don't know, maybe this is for Ms. Prosper-Chen, what sort of program or drive is in place really to treat with this?
Okay, so we do have a community mental health program where we run clinics, we do home visits, we answer crisis calls, whether it is on the phone or face-to-face. So that is there. You can call the health department. I can put a number in the chat where persons can call to get assistance. But bear in mind though that if it's someone on the street, our intervention is not alone generally, it is with the police. And in fact, we have even trained the police in how to deal with the mentally ill. Now, the police has the authority to take a person who is believed to be mentally ill, to take them into the hospital for any assessment. So you are covered there, and if you need assistance, we can also help. Just as if we go in the area and there is a complaint and we have gone to investigate, we generally ask the police to come with us. So that is something that we do on an ongoing basis. Once the complaint gets to us, and you can even go to the health center, since it's in Riversdale, you can even go to the health center and that will get to our mental health team. So there is something that can be done. And we answer a lot of these calls every day.
Right. Thank you, Dr. Prosper-Chen. So White, I hope your question was answered.
Somewhat. Appreciate it, Miss Prosper-Chen. In regard to the number though, I would appreciate you, dropping it in the chat.
I will
Right.
do so.
So here's a question though, Prosper-Chen. For that contact, is that a contact that persons can call even on weekends if the
Yes.
need is there?
Yes.
Okay, wonderful.
Yes, it is our emergency line.
Okay,
Yes.
wonderful. So you can go ahead and put that in the chat so that our participants can have access to that number. All right, so I want to know, in terms of collaboration with communities, what form of collaboration does the Public Health Authority or the NSWMA have with communities as it relates to promoting health and disease prevention within communities? Ms. Reid, you want to take this one first?
Okay, so we are very much involved in communities, right? We are a part of a number of community WhatsApp groups, right? And through these WhatsApp groups, we keep our communication and public education open. We are also big partners with SDC, right? Who as you might be aware, works directly and in the community. So the SDC, the CDC, the Community Development committees, we are as in the communities. It is our partnership over the years have grown in these communities. And so we stay close to our communities because at the NSWMA, most persons in companies, they call their department public relations and so on. Our department is actually community relations, right? So, it is called that for a reason, right? Because we work closely with our communities. We partner with our communities. We keep close contact with our communities. Not all communities in our region, but we are spreading out and we are getting there. We communicate with communities to let them know when your garbage will be collected. We let them know if there's a night collection, persons are not used to night collection. Sometimes in order to prevent backlog of garbage, we'll collect at nights. We'll send information in these groups to advise them, let them know when the garbage collection will be done. We send regular updates as well as educational information on proper solid waste management practices through these groups. We also go into communities by conducting meetings. We host forums such as compost demonstration, encouraging persons to start your own compost. And again, if you use the waste that is coming from your kitchen and start your own compost, for those of us like myself who like gardening and planting, fruit trees a lot, I don't buy compost. I make my own compost. And again, it's economic money by practicing proper solid waste management practices. And so we work very closely with our community, the root of what we do, our business in Jamaica. Without the communities, we would not exist.
All right.
So
Thank
we
you so much.
with our community.
Right. And that is good to know. And I'm happy that you have that compost demonstration. I think maybe, I don't know how often it is done or in how many communities it is done, but I believe that especially because now we know that the government is pushing this backyard gardening initiative. I believe that is something that probably could be ramped up some more so that more persons can get that demonstration, so we can start having more of that and even reduce some of the waste that are going out and start reusing what we have at home some more. So thank you so very much for that, Ms. Reid. Dr. Prosper-Chen, over to you.
Okay, so the health department works closely with the municipal corporations, and we are a part of the local board of health. And so we interact with all of the members of that board, including National Solid Waste, Water Commission, SDC, etc. So that's where we collaborate as agencies. Outside of that, now public health always will have its foot soldiers, those persons in the field that will are assigned communities, and they go into these communities and they become a part of the community, and that most particularly our community health aides. Now, the community health aid, that's a primary care or public health, well, let me say primary care initiative that we're known for worldwide. It started here in Jamaica with Prof. Kenneth Standard. And so we maintain that. So persons go into the community to do different things. They look for the dropouts for immunization, for rheumatic fever, the antenatal mothers who have not come back into care, the postnatal mothers that have been discharged from hospital and may need a visit, not just from the midwife, but also just a checkup from not a checkup, but a check on by the community health aide. We have our vector control workers. Not only are they responsible for our mosquito activities, they also do a lot of health education when it comes to mosquito control and how to prevent. We also have community peer educators, and they are specifically assigned to HIV, STI prevention. Outside of that, we have our large health education program. We interact with the schools, with businesses, with churches to spread messages. We do a lot of interventions with businesses, what we call our workplace wellness programs. And right now we're trying to get men. We're trying to reach out to men. Outside of that, we have our outreach activities, oral health, community mental health, school health. And so public health must be community-based. And so a lot of our programs are with communities.
All right, thank you so much. Once again, we are learning so much. We're learning so much. And if a church wants, or any group wants to have you come in and do a presentation, either for you, Ms. Reid, or Dr. Prosper-Chen, they are able to reach out, and that's something that they can have done.
Yes, yes.
Okay, wonderful.
Certainly.
Send us an email or call us. Yes.
All right. So what I would ask is, well, I'm seeing where
As a
contact
matter of fact, we
information.
encourage that. We encourage persons to invite us to your community meetings and community groups.
All right, wonderful. So, there's no reason why the education or the educating of our citizens should stop or fall short, because you are ready and willing to meet the citizens where they are to provide the information that they need. And that is wonderful. And we are encouraging you, ladies and gentlemen, on the platform, for your respective communities, churches, whatever groups, businesses. If you want persons from the Public Health Authority or from the NSWMA to come in and do either demonstrations or to do presentations, please feel free to reach out, and they will come in and provide the necessary information that you need. Now, there is a question that I want to ask, and I think I want to touch on it before we get to the end of our discussion, because there are so many questions that we could ask, but time just doesn't afford us the opportunity to. But in many communities now, and it is something that we have been receiving reports of here as the police, is there are within certain communities animal rearing that is taking place. Persons are starting their own little backyard pig farm, their own chicken, poultry rearing in their backyards. Some may even have goats. Some have dogs. What is the stance on the animal rearing in certain communities, and how does the public health authority address the concerns of citizens as it relates to animal rearing and even pet raising in our communities? Dr. Chen?
Well, once a complaint is made, then the health department has to assume then that it is a nuisance. And the
Right.
nuisances fall under the public health, is one of the regulations under the Public Health Act. So once it is reported to us, then we do the necessary inspections and make recommendations. And we have, if we think it is necessary, we have also served notices and taken persons to court. So it is something that can be reported to us, and we will do the necessary inspection. If we think we also need the municipal corporation to be a part of the intervention, especially when it comes to zoning and where you can rear animals, then they are also brought into the picture.
Okay, wonderful. And in terms of regulations for some persons, or for persons to know what are restricted from happening in certain communities. For example, the same animal rearing in, let us say, a gated community, and somebody feels that, you know, they want to raise some poultry for either their own household use or even to make some extra money. Is there any education campaigns to inform persons as to whether or not this is permitted or prohibited?
I think for a situation like that, it would, yes, the health department would be involved, but also especially if it's a gated community, then what is your strata saying? And persons must also seek advice from the strata corporation, because they too would have certain stipulations as it relates to animal rearing and so on. And we have come across communities or gated communities where persons are raising animals and they're not allowed to. But and so your first recourse is to refer to your strata agreement.
Okay.
But once there is an issue, please get in touch with the health department. We will come and guide you through.
All right. Thank you so much, Dr. Prosper-Chen. And I believe, and you can correct me if I'm wrong, that, you know, this also applies to where persons have their dogs that may even be operating as noise nuisances to their neighbors, correct?
That is correct.
So in a case like that, how would it be treated? Because if I have my neighbor has their dogs, and right through the night they're barking, etc., and you know it's preventing me from probably sleeping, how would a situation like that be treated?
You know, I'm not sure. I'm not sure about that. But I can get that information and I will relate back to you.
All right,
So,
thank you so
so
much.
that's not for the police?
Repeat.
That's not for the police.
That sounds like a breach of the Noise Abatement Act. But yeah, I think on that we would have to collaborate on that one, Dr. Chen. Right. So what are some of the major health and environmental concerns though that for the Public Health Authority here in Jamaica? What are some of the major health and environmental concerns for both the Public Health Authority and for the NSWMA? Sorry.
Should
Go
I
ahead.
go first?
Go ahead, Dr. Chen.
Okay, I think now we have to look at vector-borne illnesses.
Mhm.
We are seeing dengue outbreaks more often. About 15 years ago, maybe an outbreak might have been anywhere from 3 to 5 years. Now we are told to expect it every 2 years. We might see a dengue outbreak, and it can cause significant morbidity and mortality. And so one of our battles is to get persons to understand that the mosquitoes that we're concerned about are not really the mosquitoes in the drains. It's the mosquitoes in your home. These mosquitoes are the ones that like to live near to people because that's where they get their blood meal. And so changing the whole behavior in terms of how you store water, if you cover the water, has to be and is and probably will always be a significant public health concern. You know, we have spent quite a lot in trying to control the dengue outbreaks. And maybe it is impacted too by even climate change. That might also have something to do with it. Outside of dengue, we also must expect that we will see Zika and chickpea again. Other public health concerns, our communicable disease, our STIs, our HIV, we're seeing more cases. The emphasis on prevention, and maybe it's our fault, but we find that persons no longer pay much attention to that prevention, that aspect of HIV. And we are seeing an increase in cases, at least I'm speaking to St. Catherine. And so that is a major concern for us. What more do we need to do, and what else do we need to look at in order to bring the numbers down? We have a target, you know. We say that if we can diagnose 90% of those persons who have HIV and get 90% of them into care, and 90% of those in care becoming suppressed, meaning that the viral load is very low, then maybe by 2030, we might be able to eliminate AIDS. The virus will still be there, but we won't get to AIDS. So those two challenges, cancer is also a challenge, especially for women. Cervical cancer, especially, and that's why we have the HPV vaccination program for the girls and young boys. So that also is something that we all need to be aware about and understand that 56% of the cancers of the cervix is caused by the HPV, So there are significant public health issues that the health department is always working at and trying to get into our communities, provide the necessary education, encourage persons to take these areas seriously, these aspects of health seriously. A very large elephant in the room is our chronic non-communicable diseases, hypertension and diabetes. More than half of the world is obese, maybe even more than 75% of the world. And we see the similar statistics in Jamaica. And so how now do we change behaviors? How do we change the idea that if you don't have curves, lots of curves, and if you're not, what they call it, fluffy, whatever the word is, then you're not attractive, you know? And how do we do that? How do we get to men? Men's health is also an issue for us. So there's a lot that we can discuss. And I could go on all night about our challenges and some of our issues. Environmental, I mean, we've already spoken to Vector. We will always have our challenges because a lot of what we try to do is related to changing behavior. And we spoke to that already.
Right.
So that is what I have to say on that.
All right, thank you, Dr. Prosper-Chen, and I hope that persons on the platform are listening and understand that it's important for us to take our own health seriously and do what we need to do to keep ourselves healthy. So, Ms. Reid, it's over to you. Tell us some of the health and the environmental concerns for the NSWMA.
You know, I'm sitting here and I'm listening to Dr. Prosper-Chen, and the concerns of Dr. Prosper-Chen is the same concerns that we have at the NSWMA and its regional bodies. The same vector control issues, right? How do we get persons to take personal responsibility for the waste that they generate? How do we get persons to understand that proper garbage disposal, first and foremost, containerization, right? So that is very important, right? You must ensure that the container that you put your garbage must be bagged first and foremost before it goes in the bin, right? Why it must be bagged? Because it prevents the catchment of water if it rains, right? Or when the waste is broken down, the biodegradable waste is broken down, it produces the water that we call leachate here at the NSWMA's regional bodies. That smelly liquid that drains from the truck, that persons call us to say that our trucks smell up their communities. It's actually not us, because our trucks come out clean in the mornings. It's a waste that goes in the truck, right? That smells up the community, right? So how do we get persons to understand that you must bag the waste first? Because it has to be personal response. How do I protect myself? Right? So I must ensure that my waste is bagged. I must ensure that the container that I'm putting my waste in, if it's a drum or a barrel, the bottom must be pierced, right? So that it does not retain water, right? So how do we get persons to understand that you don't take the garbage out on the main road and put it out, because it comes right back to you and it comes right back to personal responsibility? How do we change the behavior of persons, right? You know, it is too easy. It is much too easy for us to be driving and we eating and we just push our hand through the window and drop something. It's too easy for us to do. It's the hardest thing for me to do. I rather to store the garbage in my vehicle until I get to somewhere and take it out when I get there. Mark, there are times when especially for those of us who have children, my vehicle is filled with all kind of snack papers, all kind of things, you know, but I'd rather it in my vehicle than it being on the street. It's the hardest thing for me to do. How do I get other persons in my capacity as someone who is responsible for educating the Jamaicans on proper solid waste management practices? How do I convince somebody to take personal responsibility? That is a concern that we have here at the NSWMA. How do we get persons to understand that it's not the government responsibility alone, right? So
That's
that is a
right.
major concern that we have. It's not because we can't do it on our own, right? Our responsibility is to ensure that we collect it and dispose of it in an environmentally friendly way. But before we get it, what's your responsibility? You must ensure that, one, you reduce the amount of garbage that you generate, right? So buy in bulk, don't take packages you don't need. Ladies, for those of us who have big handbags, when we go to the pharmacy or so and we buy smaller, don't take the paper. I don't take them. I tell them it's okay. I'll drop it in my bag. I don't take additional or unnecessary garbage with me. I don't, right? Or when you go to the patty shop to buy a patty, you're buying 2 patties. You're going to eat the patty you alone. Why put it in 2 bags? Tell them just put it in 1 bag, right? And take the patty and go. Right? So these are just some little things that we do. How do we try to reuse what we have generated? Use it for something else instead of throwing out whole clothes. Why don't we donate it, wash it and donate it to Salvation Army? Because one man's trash is another man's treasure. How do we try to reuse glass bottles, right? Instead of going out and buying jars to store peas and those things in, how do we use the glass jars that we buy other products in and use it to store items instead of going out and purchasing other things, right? Can we take a little time out of our day to separate our plastics? You know, take it out of the regular waste, right, and separate it. So these are some of the things that we want persons to understand. How do we get persons to just inconvenience yourself just a little bit in order to provide a wider, bigger picture of, you know, just caring for the environment, you know, and making it safe for everyone to live in, right? So that's a major uphill battle. That's the concern that we have here at the NSWMA.
Wow. Miss Reid, I hear you. I can hear the plight in your voice, wanting persons to make that change. And it is so important because one of the things that we have not mentioned on this platform yet is the fact that improper storage or disposal of garbage leads to rodent infestation, which then leads to leptospirosis, which is another major health concern, for us here. Rats, I believe that here in Jamaica, we hate to see rats, but yet still we are doing things that encourage the reproduction and infestation of rats. And so that is something that we have to be mindful about because leptospirosis can kill. It can kill and has killed human beings. And so that is another major health concern for us here that we have to look at. And we have to understand once again our responsibility. So yes, the NSWMA has their role and their responsibility. Yes, the Public Health Authority has their role and their responsibility, but we also have our role and our responsibility. Whenever we talk to persons about safety, we, the police, tell persons that your safety is your responsibility. But here we're also hearing that your health is your responsibility. Managing your waste is your responsibility. So we don't want to negate the responsibility of our citizens and cast it off on the respective agencies that are there to serve the country. We want us to understand that we also have a role to play in keeping ourselves healthy, keeping our environments clean and healthy as well. So that is the message that is going out to you, our citizens here this evening. And we want you to share that information with others that you come in contact with your neighbors, your friends, church brother, church sister, etc. And teach your children. Teach your children. Let us start passing on the information and spreading the education so that we can begin to effect change in our society, because that is where the real issue is, and that is where the real impact will take place. And then and only then can we actually begin to see the change that we really want for our society. And with that, ladies and gentlemen, we are coming down almost at the end of our program. But just before we go, ladies, I just want you to leave one last comment or message with our participants here this evening. So you can go, whoever wants to go first, go ahead.
All right. My message to Jamaicans and to the persons on the platform: partner with us. Help us. Help us to help you. Without your help, our job is futile. We will not achieve what we need to achieve without your help. Government, we can't do it on our own, right? We ask parents on the platform, teach your children not to litter the streets. Tell them to put their garbage in their bags or in their pockets until they get to a bin, or until they get home, they put it in the bin. Tell them not to throw the garbage through the window of the cars when they're driving in the window, in the cars. Tell your passengers in your vehicle, don't throw garbage through my window because it's a reflection on me as the driver of this vehicle, right? Do not do that, right? Encourage your neighbors to package their garbage properly. Encourage your neighbors to package it also in a way that they keep it away from animals, so that the animals don't get to the garbage and spread it on the street, right? Or spread it in the community, right? Keep your garbage safe away from animals. Elevate it if you have to. If you have a drum, right, secure it to a sturdy place, a post maybe the grill on your wall or something, right? Put something heavy on it so dogs can't turn it over. Ensure that you practice the 3 R's. You reduce, you recycle. In this case, not the 3 R's, 3 R's and S. Reduce, reuse, and separate your plastic bottles from your regular waste, right? Take personal responsibility for your environment and your surroundings, right? You must do that, right? Because you have to first and foremost safeguard yourself before you ask someone to safeguard you. It must be your responsibility, right? And again, I ask you, help us to help you, right? And we have a slogan at MPM, right? Going forward, if you're not doing so, bag it, bin it, and we will collect it. Okay, thank you.
Thank you so much, Ms. Reid. Dr. Prosper-Chen.
I think I just have one simple statement. Our primary goal in public health is to ensure a healthy population. And that is what we're all about. Our programs are designed to do that. And we would like persons to understand that they play a role in keeping themselves healthy, in ensuring that their children are healthy and their communities are healthy. And if we're able to do that, then we will have a healthy population. We are here to help, reach out, and we will help as best as we can. Thank you.
All right. Thank you so much, Dr. Prosper-Chen, the head of the St. Catherine Public Health Authorities. Thank you, Ms. Rachael Reid, the Customer Relations Officer for the NSWMA/MPM. And ladies and gentlemen, I want to thank you this evening for joining us as we discuss the role of the Public Health Authority in promoting health and disease prevention here in Jamaica. And I'm hoping that you would have gotten something out of this discussion this evening. And that something is that you have a responsibility. You have a role to play in keeping our environment, our homes, ourselves healthy, safe, and clean. And with that, ladies and gentlemen, I just want to say thank you. And we look forward to having you join us here next month via this same medium when we will be discussing another topical issue and educating our families. Thank you so very much. You have yourselves a wonderful evening, and I am your host, Corporal Kester Fennel, here from the St. Catherine North Division. Have yourselves a wonderful evening.
Yeah.
Thank you, ladies, so much.